Hello, my name is Rocky Hill, and I'm Director of Hill Alcohol and Drug Treatment in Temecula, California, and Three Hills Ranch Residential Recovery. And we're going to talk today a little bit about what is addiction, but most of all about a revolutionary concept, and probably the biggest thing I've seen in terms of a change in addiction treatment in the last probably 25 years. And it relates to opiate addiction, and the medication is Suboxone. And so we're going to talk about that and go into the details of the benefits and the liabilities and the use and some of those kinds of things, so that each of you will get a better understanding of hopefully what addiction is, but especially as it relates to opiate addiction, which is right now we're seeing a huge upsurge of the use of drugs like prescription drugs like Vicodin, Norco, OxyContin, that then very often morph into eventually the use of heroin. And this is specifically hitting our young people in the ages between 18 and 25. And as a clinician, this is worrisome for us. But again, I don't like to use the miracle word when we talk about addiction, because we've had in the past supposed miracles that were going to be the cure, and in fact there was no cure. Addiction is a disease that is prone to relapse, and that continues today. But we have a new tool, and more we're seeing that new tools are coming from science. And this is just a new way of dealing with opiate addiction and enhancing what we do in the treatment process. And so we want to talk about it today and go into detail and perhaps demystify and clarify some of the realities of opiate addiction, what happens to the brain, and Suboxone. I've got about 28 years in this field now in addiction treatment. Prior to that, I was a juvenile parole officer for the state of Oklahoma. I have my own problems with alcohol and drug addiction. I spent 14 years using all types of drugs: alcohol, methamphetamine, cocaine, opiates, barbiturates, lots of different types of street drugs and prescription medications. And finally, actually today, December 3rd, 1980, I went through treatment and fortunately have been able to remain clean and sober since then. And so there is hope for recovery, and we're going to talk a little bit about the specifics of addiction, recovery, and how it applies